Hi, my name is Amanda Sotelo, and the topic that I'll be covering is the detriments of mental disorders concerning suicide attempts and ideation. Now, a little history and background information concerning the global suicide crisis. Suicide is actually the 10th leading cause of death in the US alone. An estimate of 8 million people die each year due to mental illnesses, many of which are suicide. Statistically, men are more likely to actually commit suicide, whereas women, on the other hand, are more likely to consider and attempt suicide. In 2018, there was an estimate of 1.4 suicidal attempts. Now, two studies have came together in different time periods to test the theories of mental health being related to suicide. Now, the first article, their hypothesis was to determine whether having none, one, or more, meaning two, mental disorders cause an increase in suicide risk over a long period of time. In the second study, their hypothesis was to focus on how mental health contributes to suicide ideation and attempts and explores to differentiate the transition of both actions. Now, for the first study was known as the Lensby study. The Lensby study was conducted by gathering participants who were monitored between a 54 to 64 year time span. They had three ways of conducting their studies with their participants. The first one was one-on-one interviews. This was either in person or over the phone. The second was interviewing key informants such as family, friends, or co-workers. Then there was retrieving external sources such as autopsy reports or medical files. They were also subdivided by diagnosis if they had any, and were defined by 5-level impairments, going by mild, moderate, medium, severe, and very severe. Some of the mental disorders that they looked into were psychosis, depression, organic brain disorder, anxiety, alcohol use disorder, or no diagnosis, and other psychiatric disorders. As you can tell by the chart, people that actually suffered from a mental disorder and people that suffer from multiple actually shows an increase in suicidal risk. In the second study, participants were gathered by collecting patients who actually had mental disorders. They were divided into 4 subgroups. The first was patients without suicide ideation or suicide attempts. The second was current suicide ideation. The third group was lifetime suicide attempts, and the fourth was suicide attempts in the previous year. Now, what are their concluding results that they both show and correlate suicide with mental disorders? Well, for the first study, it indicated a significance in suicidal risk between participants who either had none, one, or more mental disorders. When considering gender, men were experienced a greater risk of suicide compared to women. In the second study, it indicated that individuals who attempted suicide in the previous year experienced greater levels of hopelessness, borderline symptoms, non-suicidal self-injury, and lower levels of meaning of life. Now, here are some of the contributing factors for people that have none or more mental disorders. It is a contribution to why they commit suicide, but we have to keep in mind that there are other factors playing a role into these people's lives that makes them commit suicide, such as relationship problems, financial issues, job loss, legal crime, and so on and so forth. Here in this study provided by the CDC, it shows that people who died by suicide may have had multiple circumstances other than their mental disorder. And this concludes the end of my presentation. I thank you for your attention. If you yourself or you know somebody that is struggling with suicidal ideation or contemplating suicidal thoughts, please reach out to this website or call the National Suicide Hotline. Thank you.